Universities, we have a role to play in addressing sustainable development goals, and we are working with partners all across the world, and today is here to celebrate the work we do with our partners in Kisii. This is a partnership of equals. We work with mutual respect, learning from each other with total humility, and trying to address challenges that we all face. So it's working with people here. We are learning.
It's saying we do work with partners all over the world. One of the most important partners to us here is in Kisii, both within the university and within the county. And we very much have listened to what our partners have had to say, and there are three things that we are really focusing on at the moment. The first is looking around the student exchange and actually giving medical students, both here in Kisii and in the University of Manchester, the opportunity to travel to the other country and to experience life, education, medicine in both countries. It is clear that they have both absolutely enjoyed their experiences. Our students have felt very welcomed here in Kisii. I'm glad to say that your students felt welcomed in Manchester. But I know, also listening to them, that actually that experience is going to shape what they want to do in the future. So they really are going to take that experience and make a difference going forwards, which is fantastic.
Of the International Summer School in Medicine in the University of Manchester. This is a program that brings together more than 30 universities from across the world. So we had students from Europe, students from Asia, students from Africa. So countries that were represented were Kenya, Egypt, US, UK. So many countries were represented, and the goal of this program was to harness research skills, number one, number two, harness clinical skills, and number three, talk about patient-centered care. So as part of the program, we were able to have...
Talking about, we've discussed today, is in and around emergency medicine, and actually thinking about what happens to that person in an emergency when they call for the ambulance, and what happens in that process from the ambulance arriving right through to the hospital. How do you give that treatment that's required to help sustain life all the way through from that initial contact and the ambulance arrives right through to actually reaching the hospital itself. Hearing that, listening to the impact that it may have here in Kisii is absolutely amazing. Hearing that currently you only have 2 ambulances for 1.3 million people, and you should be having something more like 13 ambulances, and the opportunity to actually increase that number to be able to make that difference is actually very inspiring.
From University of Manchester, we have donors and philanthropists from the United Kingdom who are interested in collaborating with us. We have made requests for funding to improve our emergency services with an aim of integrating our emergency services with the county disaster management services. Already, we have received support for an ambulance training program that will see 60 paramedics trained to international standards. We have also explored funding opportunities so that we are able to pilot specific programs relating to cancer and start to support over 100 cancer survivors. On healthy workforce training, as you all know, no country develops without training its workforce. No country develops without a strong workforce, which is a human resource. We are collaborating so that this is done with the support of Kisii University, and further do much that will be required going forward with the support of Manchester University. Already, we have hosted 2 cohorts of students from the University of Manchester and preparing to host the 3rd cohort coming soon. Kisii University has also sent out 1 cohort of 15 students to the University of Manchester. We believe this collaboration will not only enhance our ability to give emergency services, but also to make sure that our people receive the services they require as and when required and in good time.
Take part in clinical skills and see what healthcare training looks like in those different countries and how we can improve healthcare training in our country. One of the things that was particularly outstanding in the program is that we were able to take part in a virtual reality session. So what that looks like is that you put on virtual reality glasses and you're able to talk to a virtual patient, take history, take examinations, and honestly that for me is the future of healthcare training, and being part of a program that does something like that was really mind-opening for us, and also just generally the cultural exchange, being able to visit the UK, that was really important. And then also just talking about healthcare systems, like for example we had conversations about the NHS, which is the healthcare system in the UK, and trying to figure out how you can be able to deliver healthcare that is free at the point of delivery, and comparing that to the Kenyan healthcare system and seeing just lessons we can borrow. So this exchange has been particularly very impactful to me and the 15 other students, and just Kisii University in general, being able to take part in a program like this that opens your mind to global health, to global perspective, to seeing healthcare from a global view has been very instrumental to us.
The last bit that I'm going to pick up is in and around breast cancer. This is actually quite close to my own heart. It is my own research area, and my own sister-in-law was diagnosed far too early with the disease. But hearing what is being done here in Kisii to look at survivorship, to look at how we can support patients going through the screening, diagnosis, treatment, and right through to survivorship is really, really amazing. But the other thing that's actually really surprising, well, I shouldn't say surprising, really lovely to hear, is actually all the learning that's coming back into Manchester that comes out of that project. What is being done here is inspiring how we will improve service there in Manchester. So to be able to actually see that happening is great. That is true partnership. It's that opportunity to learn